Today is the third part of three-part series on fatigue. So I'm going to talk a little bit about the big picture, then I'm going to go into what we're going to be talking about today, which is inflammation and the gut and that kind of thing. And then we're going to do a little bit of a review of fatigue in general. So for those who don't know me, my name is Dr. Laura Robin. I'm from Impactful Medicine, and my mission is to help as many clinicians as possible get functional medicine principles into their practices. So I'll talk a little later about the couple things that I'm going to be doing. One is an immersion course in September, and the other is that I have a boot camp for patients called Total Health Reset. So I'll talk a little bit about that later. But let's talk about energy and let's talk about fatigue. So fatigue, it's a crisis in the United States. Up to 31% of adults complain of it. And it's one of the top 10 things that people complain of when they go to their primary care physicians. And as we've discussed in the other two talks that I gave, it's got lots when we actually look at the roots of what goes on in our bodies, we see that there are many, many, many causes of fatigue. The good news is that we know that there are many causes of fatigue. So if we can dig down deep and get to some of these roots, we can turn them around. We can help people turn their health around. And I've worked with many, many patients doing this. And anyway, this is one of the things that I teach. So, but when somebody comes and they complain of fatigue, there's not really any clear path to a diagnosis or treatment. And it becomes, like I remember in my practice, I used to ignore it because everybody complained of fatigue. It was just one of those things that, everybody complained of. So I didn't really, I said, of course you're fatigued because everybody complains of fatigue. And I didn't really know what I could do about it. But, of course, now we're, 20 years later and I'm teaching about it because that's the way a lot of clinicians still look at fatigue. Like, well, it's a problem, but, it's too complicated and too vague. So let's keep talking about fatigue so we can get to the bottom of it with our patients. So anyway, this webinar series, we have had the first parts already, defining it, looking through a new lens, looking at mitochondria, metabolism, sleep, nutrient status. Last time I talked about the relationship between hormones and energy, specifically looking at thyroid, adrenals, sex hormones, and also we talked more about sleep. And then today we're going to talk about the gut and immunity and inflammation and how they relate to energy in the body. Okay, for some reason, there we go. Okay, so again, a lot of what goes on in our bodies is kind of like that old story about that hopefully isn't true, about the frog in boiling water, and that if you put a frog into a pot of boiling water, it's going to jump out immediately because it's going to notice it immediately. If you put a frog in tepid water and then you slowly heat the water, the frog is not going to notice. And hopefully this is only a story, but this is also the story of fatigue and lots of chronic symptoms in general. So what we want to do is we want to pay attention to what the temperature is of the water, even if the water is only starting to get warm. And as we talked about from a conventional medicine perspective, we, when doctors look at causes of fatigue, they look at medications, alcohol, drug use, and they'll test for anemia, they'll test for maybe other chronic illnesses. They'll also, if they're paying attention, they will test for vitamin D, B12. They may look into mood as being a cause, and they'll look at a TSH level and sleep. But as we've been talking about, that hits some of the causes of fatigue, and what we're talking about here is taking that much deeper dive. So let's jump into talking about the gut and inflammation and how that relates to fatigue. So Hippocrates, like that was a very long time ago. He used to say that all disease begins in the gut. And that might be an overstatement, but it actually might not. And another statement might be that, and this is a common functional medicine statement, is that if you're considering trying to heal yourself from chronic disease, chronic illness, chronic symptoms, you can't even consider healing these things without paying attention to the gut, because very often the gut is involved and maybe primarily involved. So really quickly, this is what our GI system looks like, and what we're going to be, well, a lot of times we don't pay enough attention to what goes on in the oral cavity. I'll talk a little bit about that later. And we are going to be focusing a little bit more on what goes on in the small intestine. So the functions of the gut: digestion, absorption, and what a lot of people don't know about the gut is that that 70% of our immune system is actually located in and around the gut. So our gut is responsible not only for breaking down our food, digesting our food, making sure that we're absorbing our nutrients, but also sensing our immune system. Our immune system is sensing what's going on all of the time, and is very on guard for things that we might be taking into our bodies that don't belong there. And also, of course, our gut is responsible for getting rid of what we don't want to use, and kind of moving the waste along in as poop, and then also initiating detoxification when we come into contact with toxins. So one thing I just wanted to say is that when we're talking about the small intestine has an enormous surface area. The surface area of the small intestine is about the size of a tennis court. So that is like, just think about that. Every person's small intestine has a surface area about the size of a tennis court. Okay, so now this gives you a little bit of an idea of how important that could be. Okay, so this is what a healthy gut wall looks like. So imagine the lumen of the gut. Okay, the gut is a tube, and what we're looking at here is we're looking at the edge of the tube. And the edge of the tube is made up of cells that are they're columnar cells that are very tight up against each other. In fact, the junctions between the cells are called tight junctions. Okay, and what makes the surface area of the inside of the gut are these villi. So these villi are little outpocketings of tissue, of cells actually, and they make up the entire lining of the small intestine. This is what they look like on an electron microscope. They're really pretty beautiful. It's just amazing. I wish we could just take a tour of our bodies from, I'm sure there's a movie out there or something, but to take a tour of our bodies from a electron microscopic perspective. I know there is a movie out there. Anyway, this is what the villi and the microvilli look like. And again, they're made up of these cells that with the tight junction that are right next to each other. And they're basically, consider it like a little army of, like we would have an army of soldiers who are shoulder to shoulder, and they're not going to let anybody through. And that's what these tight junctions are all about. And inside of each of these villi and microvilli, there's a whole big capillary network. And this is where when nutrients are absorbed in, they go immediately into the bloodstream. And this little purple area in here is fluid tissue that also has a lot of immune system cells in it. So that is, we're going to, you know, when I said up to 70% of our immune system is in and around our gut, this is a big part of that. So I just wanted to show you a picture. This is a picture of what used to be microvilli in somebody who has celiac disease. And so instead of those beautiful microvilli that we saw on that last slide, we're seeing a total flattening of the microvilli. So this person does not have the surface area of a tennis court. This person has much less surface area and a very disturbed system. So when we look at this again in microscopy, we can see the profile of the healthy microvilli and what they look like, and then we can see how it flattens out in celiac disease. Celiac disease, just for those who don't know it, is an allergy to gluten. So this is just one example of an inflamed intestine, and an intestine in which the immune system that is in and around the gut is just really angry and inflamed and causing destruction. I wanted to just talk for a minute about the microbiome of the gut, because the microbiome is basically the ecosystem of the gut, and it's estimated that we have about 100 trillion microbes. That's a lot. 100 trillion microbes in our gut that are inside the lumen, inside the tube of our gut. And there are several different kinds, and they have many different jobs in there. And it's estimated that these 100 trillion friends that we didn't know we have weigh about 3 pounds. So we have about 3 pounds of good bacteria, mostly, and other microbes inside the lumen of our gut.
Cool.
And only
now
in the
not
last
feel
15,
lonely
20
after
years
that.
we've actually been paying attention to what they are, and we're learning that whole ecosystem is incredibly important, and which microbes are in there, and how they react with one another, and you know, how much you have of one kind versus another kind. Very, very important in digestion and in how the immune system works, but also the microbiome affects our neurotransmitters. It affects it affects our endocrine system in how the hypothalamic pituitary axis, we talked about that last time when we talked about our hormones, but how our whole hormone system works. Believe it or not, those microbes have a lot to do with that and can affect that, because they influence neurotransmitters. They can also influence our moods and also our levels of energy and cognition, that kind of thing. We've seen evidence that the health of the microbiome has an effect on the autism spectrum. And what we're here to talk about today is the influence that it has on the immune system and whether we have inflammation. So this is a very busy slide, but I just wanted to show you that these are there are many different strains of microbiota, of mostly of good bacteria and also some bad bacteria. But this whole picture is just to show you how these different strains have effects on all different parts of our bodies, from our lungs to our liver to our bones, to our brain. So our microbiome is super important. A lot of people who are being treated by functional medicine doctors are being given probiotics and say, well, why do I have to keep taking probiotics? What probiotics do is they help not all of us have all of the strains that we need to have. For example, some people who may have been born by C-section as opposed to vaginal delivery may not have gotten the strains from their mom and maybe missing some strains. Those of us who have been on many different medications like antibiotics, steroids, birth control, that kind of thing. Each one of those medications, many medications affect the microbiome and then therefore can affect all of these different functions, including levels of energy in the body. So, yeah, as I was just talking about, and lots of things can affect the microbiome. And so we talked about mode of birth, we talked about medications, but also diet and the composition of diet, whether we have enough prebiotics or foods that support the microbiome. It changes with age. So there are many different, and genetically we may be predisposed to certain microbiomes. I'm going to talk a little bit about the immune system in and around the gut, but first let's just talk about the immune system. So we have two different basic parts to our immune system in our body. One is called the innate immune system and one is called the adaptive. So the innate immune system it's like I hate to go back to the army thing, but it's kind of like if we have an army, it's just like a general army. It's just like a general security system that's going to be open to whatever might come to it. And so the innate immune system is there and is going to react to anything that doesn't feel like it's part of us or doesn't feel like it belongs there. So with that, we've got all of these different cells on the left side of the slide, the eosinophils, the monocytes, the basophils, the mast cells. We hear a lot about mast cells, and they're one of the main causes of allergic symptoms in the body. And macrophages and neutrophils, each one of these cells, our immune system has all of these different kinds of cells, the natural killer cells too, has all these different kinds of cells. They're more general and they tend to be just generally reactive. So let's say that somebody has an allergic response to, when they eat dairy or something like that, they get all stuffy. That is that can be a general mast cell response. It can, if somebody is breathing smoke, we're getting into smoke season here in Oregon, that the way the body reacts to it is really the innate immune system. The adaptive immune system is what happens over time. So when somebody becomes progressively more allergic to, let's say, a bee sting, or progressively more sensitive to a food that they eat all the time, like gluten or like dairy or something like that, that is because of the differentiation that is happening with the adaptive immune system, that these cells, the T cells and B cells, actually make antibodies against specific molecules, and that is and so that the next time that molecule is presented, whether it's gluten or dairy or anything, or grasses or cats or whatever, that person is going to have a reaction to it. So as I was talking about, the immune system in the gut it's considered to be the largest lymphatic organ in the whole body. 'Cause it contains 50 to 70% of the cells of our immune system. So, and it is the first line of defense. And so what it wants to know is what is friend and what is foe. So I'm going to talk a little bit about, like, okay, so just to back up a little bit, we're talking about fatigue, right? Let's get back to the fatigue. And we're talking about the gut as being so important in energy levels in the body. So far we've talked about the anatomy of the gut, and then we've talked about the microvilli as being so important, the surface area of the gut, the fact that the microvilli and all the cells that are lining the gut are just plush with immune cells. Okay. And so now we can talk about kind of what, and we talked about the microbiome, which is the whole complement of good bacteria that not only help us with our digestion, but also help with neurotransmitters, help us with the immune system and all of that kind of thing in our gut. Now we can talk about kind of what goes wrong. So one of the things that can go wrong is, our microbiome can be off. That can affect our neurotransmitters, which can affect our energy. I want to talk now about leaky gut. So again, we're looking at the inside of the lumen, the tube of the intestine. So when we're looking, we see that these cells are lined up on the left. They're lined up beautifully. The tight junctions look very normal. We've got the microvilli that are there to increase our surface area and help with our absorption. And then underneath, behind all of those cells, when things are absorbed in, they're absorbed into the bloodstream and the tissues back there that have all of the immune cells and all of the, everything. It is just the gateway to the rest of the body. What leaky gut is when those tight junctions get not so tight anymore. And that happens when the immune cells are reacting to things. So let's say that you do have a sensitivity to gluten, which it's estimated that only like 5 to 8% of people actually have an allergy to gluten, which is what celiac disease is. But it's estimated that up to 95% of the population in America has some sensitivity to gluten, reacts in some way in their immune system to gluten. It's not necessarily, only a few percentage of people actually have the specific antibodies that qualify them to have celiac disease, but there are many different ways. Remember, the adaptive immune system and the innate immune system. The innate immune system is what's responsible for up to 95% of people in this country actually reacting to gluten and having reactions also to just more generalized reactions to certain foods. So when inflammation happens, that actually causes some molecular changes that then cause those tight junctions to not be so tight anymore. When the tight junctions aren't so tight anymore, you can see that anything that's passing through or the lumen of the intestine or products of digestion can then get through these areas and into the general circulation in the body. So what are some of the triggers of increased intestinal permeability? Well, dysbiosis, which is a irregularity of that microbiome of all the good bacteria that helps to keep everything in good shape. As I said, food allergies and sensitivities, and also other systemic illnesses, low stomach acids, or digestive enzymes, bad dietary choices, like all the processed foods and all of the additives that are in a lot of the foods that are out there at the supermarket. these are all things that can cause, they're seen by the immune system that's in around the intestine as foe rather than friend, and the immune system gets activated, and then those tight junctions start to melt away. So again, this is just another picture of leaky gut. On the left side, a healthy gut, and on the right side, a leaky gut. And you see that when things start getting through, and then they come in contact with the immune system, it can really, can get ugly in there. So the what generally happens is we have inflammation of the gut lining, and when that happens, this is kind of what happens in a cycle, and what happens to the immune system when all this happens. When we have inflammation in the gut lining, it can lead not only to malabsorption of things like B12, magnesium, iron, and other nutrients, but it also, as we were talking about, causes an immune response. Now, when this immune response happens, then it can cause things like, it can cause gastrointestinal issues like pain or heaviness, or diarrhea, constipation, that kind of thing, and can also cause us to develop intolerances to foods, and can mess with our digestive enzymes, all kinds of stuff. And then eventually, if things keep going and going and going, that can lead to autoimmune issues. So again, I'm not going to go through this slide, but basically this is, if this was your intestinal wall and you had an antigen, which is, any kind of a molecule that your body might react against. If it gets through here, there are all kinds of things that are happening. So there's the innate immune system that's going to cause just generalized inflammation, but then after a while, your adaptive immune system is going to be making antibodies to this antigen, so that the next time the antigen comes along, that's going to cause also inflammation and cytokines and that kind of thing. And this is a funny looking knee joint, but let's just say that this is a knee joint. And then you've got all these inflammatory reactions going on, inflammation, and you've got somewhere that is a little bit off and open to getting inflamed, like maybe an arthritic knee. That knee is going to feel it. So people say, well, when I eat tomatoes or things in the nightshade family, I feel arthritis in my hand. I'm one of those people. That's exactly what's happening, is that when you have an area that is a little bit damaged, and then you have some generalized inflammation that goes on because of antigen antibody reactions or generalized inflammation, that inflammation will go to places that are more damaged, and that's where then it will increase the pain. I've had many patients, not many, okay, I'm not many, but I probably had a dozen patients who were headed for joint replacements. Out of the 600 people who I worked with in the 7 years before the pandemic, putting them through a boot camp to decrease their levels of inflammation and stay away from the foods that they might be sensitive to. I had about a dozen people who were headed for knee replacements, hip replacements, and shoulder replacements that actually ended up not needing them, because when we need a replacement, it's because we're having so much pain in that joint, and that the pain in the joint is due to two things. It's due to the actual damage to the joint and the arthritis in the joint, but it's also, and then you've got the inflammation on top of that. So there are many people who are walking around who have had x-rays of a knee joint or a back or whatever, and those x-rays look absolutely horrible. They're in absolutely no pain. There are other people who might have an x-ray that looks a lot better than that, with only a little bit of arthritis, but they're in a ton of pain. And a lot of times the difference between whether somebody's having pain or not, it can be those levels of inflammation. So it makes a huge difference in the body. And when we're talking about inflammation, we're also we're we also know that inflammation is also a big part of the aging process, and that when we have chronic inflammation over and over and over again, or just inflammation that doesn't go away, it's affecting everything. It's affecting our mitochondria, it's affecting our detoxification systems, it's affecting the health of our cells, it's affecting our neurotransmitters, it's affecting our endocrine system. So inflammation affects so many things. It is also looking like it's a major factor in how our bodies age in general. So I want to say one more thing about allergies and celiac. You know, I can't emphasize enough that gluten is a major issue in the United States. It's a little bit less of an issue in Europe because Europe is still using older grains. America has modified the wheat that it grows to emphasize wheat that grows quickly and produces a lot. So what has happened is that we are eating a lot more wheat than we've ever eaten. We are eating proteins in our wheat that maybe have not been available in the past, and we're eating lots of it. And that's really why so many people have sensitivities to wheat and to gluten. But the other thing about wheat and gluten, and you know, a lot of people wonder why are functional medicine practitioners so concerned about gluten? There's another reason for that, and that is molecular mimicry. So what molecular mimicry is remember, we have the innate immune system that's just like the generalized defense, but then we have the adaptive immune system where specific antibodies are made against specific proteins or specific antigens. So let's say that our innate immune system, after being pummeled with these crazy new proteins that are found in the newer types of wheat that are out there that we're eating all day, every day, what happens is that our adaptive immune system eventually starts to make antibodies against that wheat. Well, now comes a player called molecular mimicry, and that is that let's say there's an antibody that is an antibody against a protein in wheat. Well, that antibody is pretty specific toward that protein, that specific protein, but sometimes it can get a little bit confused because sometimes other proteins, other molecules can look like that protein, and it can get attacked, and it can get attacked by the antibodies as if it was another protein. So then an example of that is, let's say, so let's just do this little thing. This is a picture of a girl and a dog, okay? But if you put your hand up kind of over your eyes so that all you're seeing is the bottom third of this picture, you're just seeing the bottom of the hair and the fur, it's really hard to tell which one is the girl and which one is the dog. At least it is for me, because we're only seeing a very small part of that picture. When we see the whole picture, of course, it's obvious, right? But if we're seeing only a small part of the picture, maybe the bottom quarter or the bottom third, it's hard to tell which one's the dog and which one's the girl. Well, this happens, let's say, perfect example, happens with the thyroid and with antibodies to some of the proteins in wheat. So if somebody makes antibodies to wheat, there are molecules in the thyroid cells that are very similar to the protein in wheat and also in dairy. So if somebody has an actual allergy, makes antibodies against wheat, those antibodies might also be attacking or able to attack thyroid cells. If somebody has makes antibodies against dairy, also that could be attacking thyroid cells. So you hear that if somebody's got an autoimmune thyroid, or even if they have hypothyroidism, it's a good idea to stay clear of wheat and dairy. So that explains that. But that's molecular mimicry, and it can play also a huge role in inflammation in the body, which then plays a role in fatigue. So specifically, how does inflammation cause fatigue? One of the pathways of inflammation makes substances called cytokines, and these cytokines, IL-1, IL-6, interleukin 1 and 6, TNF alpha, these are specifically implicated in fatigue. They specifically affect neurotransmitters that specifically affect our energy, our cognition, our mood, our sleep, and even our motivation. So you've heard of, serotonin, dopamine, norepinephrine. These are really important in mood and energy, sleep, that kind of thing. And cytokines, as a component of inflammation, disrupt them. As we talked about, also disruption in the hypothalamic to pituitary axis can affect the function of the adrenals and of the thyroid. And chronic inflammation also messes with that whole feedback loop, and then can cause fatigue. So inflammation affects the quality of the microbiome of the ecosystem in the intestines, the good bacteria versus bad bacteria, and other microbes. And then the health of those microbes then also affects neurotransmitters, affects lots, several different areas. We saw that really busy slide of how the microbiome affects the health of our liver and our lungs and all of that other, all our entire bodies. So we see then how inflammation affects the microbiome, and then the microbiome can affect our energy. So inflammation is also, we talked about this in an earlier lecture, how our mitochondria are very, very, very sensitive to inflammation, and inflammation can keep the mitochondria from, which are the powerhouses of our cells, how we make energy in our bodies. The inflammation can really affect the health of the mitochondria, how the mitochondria can function, and inflammation can even cause death of the mitochondria. So that would have a huge influence in energy levels in the body. And inflammation can also directly affect, we talked about how it can affect the HPA axis, or the HP axis, and affect our endocrine function, but it can also directly affect our thyroid hormones, and how our thyroid functions, and how our adrenal glands function, and also the balance of our sex hormone binding globulin. Inflammation, it can also affect insulin, and insulin can affect inflammation. And anyway, inflammation has a huge effect on our endocrine system, and in many ways can affect our energy levels. And we talked about, well, inflammation can lead to autoimmunity. I kind of touched on that, but autoimmunity has a few components. They're basically, from a functional medicine perspective, we look at three different things that kind of have the perfect storm that can lead to autoimmunity. And one of them is a genetic predisposition to autoimmunity, like somebody is born with a type of immune system that would be more apt to make antibodies against one of our tissues or multiple tissues. That's what autoimmunity is. So that one is a genetic component. Another is leaky gut is a major component that leads to autoimmunity, because that causes more of it causes generalized inflammation in the body. And the third thing is that there's generally some sort of a trigger, an environmental trigger or stress or something along those lines, or an infection or something like that, that triggers the body to start making antibodies, and which is the definition of autoimmunity, autoantibodies. So, and then just knowing that inflammation can contribute to cardiovascular disease, which then can affect our energy levels. So what are some additional causes of inflammation? So in addition to the gut as being a major influence in causing inflammation in our bodies, there are many other things that can cause it. And again, we're kind of circling around to what I've talked about in some of the other talks, but toxin load and how our detoxification pathways are working can have a major effect in how inflamed our bodies are. Our antioxidant levels, whether we are taking in enough of the cofactors that help our detoxification, in getting those toxins out, or whether those toxins are then going to cause inflammation. Underlying infections play a major role. So Lyme disease, other tick-borne illnesses, of which there are many, and they keep getting identified. Underlying infections like Epstein-Barr or CMV, these are all infections that tend to just kind of stay in our bodies and can be a major cause of low-grade inflammation that can then trigger all of those things we just talked about that can affect our energy levels. A lot of us don't think about dental health. Dental health is unbelievably important, and we have a whole microbiome in our mouths that's a little bit different than the microbiome in our gut. But the microbiome in our mouth, the more we learn about it, the more we realize that it is super important. And specifically, we're learning more and more about connection between dental health and cardiovascular disease. So that between dental health and the inflammation that causes cardiovascular disease. Again, plaque and cholesterol, triglycerides, part of the equation, but the other part of the equation, which may be as important, if not even a little more important, is inflammation. So we're looking at the dental infections as being one of those major causes of inflammation. Underlying mold, we hear more and more about that. So sometimes it can be that people have mold in their bodies more often. People get exposed to the toxins of mold. So they may be living in a place where there are lots of mold spores, or may have had a history of big mold exposure, living in a basement apartment for a couple of years or something like that. It's more often the toxins from the mold that are affecting us, as opposed to there being actual mold in our bodies. But the mold toxins are everywhere. They can be in the filtration system in our car that is so hard to get to and replace. It can be from a leak behind a wall that we don't know about in our homes. So there are many different places that marijuana industry is known for, like, significant mold. And so lots of different places where people can be exposed to mold. But anyway, what affects us and causes the inflammation usually, and the immune response, are the toxins from the mold. And there are ways to get tested and that kind of thing. Nutrient levels, to support optimal immune function, we need certain amounts of B vitamins, vitamin A, vitamin C, and vitamin D, and et cetera, to support our immune systems. And then stress, we know stress has a huge effect on the immune system, and increased stress can cause increased inflammation. So that concludes the whole conversation about about the gut, the importance of the gut in inflammation and levels of energy, and then how other things that can cause inflammation in the body and how inflammation actually affects our energy. So now I want to just kind of review a few other, bring back the last two talks, just in general, do a little bit of a quick review of the last two talks and so that we can kind of get a bigger picture of fatigue. So basically, if we can look at it from a different perspective, is that fatigue comes from three main things. One is either we can't make enough energy, which is generally from the mitochondria, or we either our mitochondria count or function or nutrient levels are not adequate for the mitochondria to be able to make what they need, make the energy out of matter. We also can have things getting in the way of energy in the body, things like medications, beta blockers, perfect example. They're just going to lower our energy, but there are many medications that have a side effect of fatigue. Anything that causes inflammation, which was a major part of our talk today, and toxins, which can not only cause inflammation, but also disrupt many processes in the body and affect energy in that way. And then the third major cause of fatigue from this perspective is what's going on in the brain. So what's going on in the brain and in the nervous system. So that's where we get into neurotransmitter dysfunction and mitochondrial dysfunction, degeneration of cells in the brain and nervous system, endocrine dysfunction, and that's how endocrine dysfunction has an effect on the brain and the nervous system, toxins, generalized inflammation, and can't emphasize sleep enough. And we've talked about this in our other in the other talks as well. So when we look at it, different causes of fatigue. We talked about today, it can come from the gut. We also talked today about how it can come from the immune system and generalized inflammation. We talked in our last talk about how hormones, the thyroid, the adrenals, the hypothalamic pituitary axis, our sex hormones, levels of melatonin, and therefore sleep, can have a huge effect on our energy levels. Also, how we metabolize food, what we take in, our nutrition, getting enough of the key nutrients, and also what's going on in the mitochondria. So I'm going to just go over kind of the solutions from the three talks that I've given. So in part one, talking about fatigue, I talked about the mitochondria, metabolism, sleep, genetics, and nutrients. So solutions, what do we do? We want to reduce the blood sugar going up and down. We want to reduce blood sugar fluctuations and treat insulin resistance. We want to evaluate for food sensitivities and intolerances. We want to make sure that we are getting adequate nutrients. We want to help to support the health and function of the mitochondria. We want to consider genetic testing for any irregularities that might contribute to differences in metabolism and in detoxification pathways and that kind of thing. We want to make sure we're getting enough water, enough hydration, enough sleep, and that we're moving our bodies, because that just helps everything. Okay. So in part two, we talked about hormones. We talked about the thyroid, the adrenals, the sex hormones, and also we again touched on sleep. So what we want to do is we want to properly evaluate thyroid function. If you haven't seen the part 2 talk, I recommend you go and review that, because the testing and the treatment of thyroid from is very, very different if you're doing it from a functional medicine perspective as opposed to a conventional medicine perspective. So we want to optimize testing. We want to look for autoimmunity, and remember that up to 95% of people with overt hypothyroidism actually make some antibodies against their thyroid. And only a small proportion of those people are actually diagnosed with an autoimmune thyroid, because in conventional medicine, we want to see conventional medicine actually requires us to see a pretty high level of antibodies before we're willing to say that it's an autoimmune thyroid. But the truth is that more than 90% and maybe even up to 95% of people with overt hypothyroidism actually do make some level of antibodies. So we need to pay attention to that. And because the cutoff is, who made that up? What is, who decided that you have to have a level of 30 to actually have an autoimmune thyroid? I would suggest, and functional medicine suggests, that even as low as a level of 2 for antibodies is something to pay attention to, because you're making antibody. Remember the adrenals. Don't forget the adrenals. The adrenals are stress glands, and we need to evaluate and treat that stress component. And that is very important to energy levels, and is very much overlooked in the conventional world. So we also want to evaluate the balance between the sex hormones for women, the balance between estrogen and progesterone, and also levels of testosterone, and in men, testosterone levels, and the sex hormone binding globulin becomes even more important in men, and will affect the level of circulating useful testosterone. We all can't emphasize again, sleep enough. So many factors. Melatonin decreases with age, but sleep is super, super important. And then today we talked about the gut, and in functional medicine we talk about the 5 R's, which it's just an easy way to remember how we want to treat and clean up the gut. So we want to remove the stuff that's not working, gluten, dairy, toxins, preservatives, additives, dyes, sweeteners, all that kind of stuff. We want to replace our nutrient levels. We also want to optimize our digestive enzymes so that we can break down our food and better absorb it. We want to re-inoculate our microbiome. We want to make sure that our microbiome is adequate, is healthy. Unfortunately, a lot of the probiotics we take, they don't stick very well, which is why we take them daily or take them a few times a week for the upkeep of our microbiome. We want to repair the gut lining and repair our inflammatory pathways, which also means that if we have a hyperactive immune system, we want to do what we can to tamp it down and make it less reactive. And that's where low dose naltrexone comes into play. That's a whole nother talk, but that's one thing that can be very useful for just helping them, an overactive immune system, to just kind of cool down a little bit. And we want to rebalance, including life balance and reduce stress and modified lifestyle. Again, dental health, super important. And then we want to address stress, detoxification pathways and toxin load, underlying infections, mold, and nutrient levels as well. So that's about it in a nutshell. And I just want to let you guys know, remind you, for those who have heard it once already, is that I've got a few really, really cool things coming up. One is on September 18th, we are launching the Elevate Your Impact Immersion. This is a mentoring / educational program for clinicians who are looking to either start using functional medicine in their practices, or they want to boost their level of using functional medicine in practice. And it is going to be, I've kept it as a small enough group that it's going to be intimate. There's going to be lots of opportunity for back and forth and mentoring and one-on-one consultation. And the whole purpose is that if you're a clinician who wants to bring more functional medicine principles into your practices, i.e. a lot of the stuff that we've been talking about, I really recommend this immersion, because this immersion is going to get you up and running in a 12-week period of time. It is not going to be as robust as, say, an IFM or A4M course that takes 2 to 5 years to complete. Of course, we have 12 weeks. But what I've learned in my 25 years of practicing functional medicine is that probably about 80 to 85% of what our patients are going to walk in with is pretty easily addressed using a certain level of functional medicine in practice. And that level can be taught and implemented in a shorter period of time. And then when we want to learn more and go deeper, then we can go to IFM and we can go to A4M and we can take all the hormone courses and the deeper courses. But what this 12-week immersion is going to get for you, it's going to get you the basics that you need to feel confident and competent in your care for 80 to 85% of the issues of patients and their issues who are going to be coming to you. So also I have a total health reset boot camp for clinicians to use for their patients, and that's available right now. And so if you have any interest, just get in contact with me and I can tell you about it. But the other thing is that we are in the process of finishing up an upgrade of the total health reset. And that's going to be coming out in October. So stand by. Anyway, I want to thank you for being here. Thanks for being on the call. Thanks for tuning in afterwards. And thanks for tuning in for the recorded version. And it's been a pleasure.